All right, so this is my next case. I'm about to do a knee arthroscopy, this time for this lesion here. There's a growth in the knee in front of the anterior cruciate ligament. This does not belong here. And whatever it is, we're going to excise it arthroscopically and send it out for biopsy. It has the differential diagnosis of a benign tumor inside the knee. And so we're going to scope the knee, identify it, enucleate it, and send it for pathology. The rest of the knee looks pristine. Nothing else going on. Menisci look fine. Anterior and posterior cruciate ligaments look fine. Patella tendon, quad tendon, everything looks good. But there's this lesion. There is going to be some arthritis underneath the kneecap. We can see the cartilage is damaged here on the medial facet. But that's not really what we're going in there for. We're going in there to excise that lesion. Right here you can see it again. And we'll send it out. Okay, so we're going to go take out that tumor from that knee. We do that arthroscopic procedure and do that excisional biopsy. Here we go. All right. We can do a timeout.
Alrighty, timeout. We have steps in, right side to left side.
So say we all of us. Pretty big lesion. I just looked at it on the MRI.
Oh, the PNS?
If that's what it is, let's see what it is. Okay, here we go. Second set. All right, 11 blade. Here we go again, making that incision next to the patella tendon at the level of the joint line, starting. Careful, careful. Excuse me, Joey. Going into the joint. There we go. Underneath the kneecap. Getting rid of the effusion, the water in the knee. Flushing it out. And going in with the scope. So here I am looking underneath the kneecap. We'll see it better. We saw in the MRI that the medial patellar articular facet go up higher was arthritic. Here's the lateral side. The cartilage looks nice and white. The medial side, that's the diseased cartilage. You can see that it's not healthy. Compare and contrast this, what we call chondromalacia patellae, to this normal, smooth, soft articular cartilage. So here's the diseased cartilage that I pointed out on that MRI, and you can see that it's arthritic. As that kneecap articulates, patient will experience pain and discomfort in the front of the knee because of that irritated cartilage right there. And certainly it's much worse there on that view. So there's no cartilage there essentially. Raise the water pressure 120. There's no cartilage there. That's just bone exposed. That yellow is just bone exposed. So, and then it gets normal again. So that's normal looking cartilage right there. Normal cartilage. Severe arthritis. That's grade 4 chondromalacia. Bone is exposed. Essentially the bone is denuded of its overlying soft articular cartilage. It's supposed to look like that. That's the trochlea of the femur. Normal. So let's go now into the medial compartment. That's the medial gutter. Around the medial femoral condyle. Flex the knee slightly, apply a valgus stress, and I'm in the medial compartment. So this now is the medial compartment. Open, close. We have medial meniscus right here. Beautiful looking knee. Beautiful articular cartilage on the femur. Beautiful articular cartilage on the tibia. Beautiful medial meniscus. Capsule. That's the periphery of the meniscus where the blood supply comes into the meniscus. Perfect. Nothing's torn, nothing's detached. Here's the anterior cruciate ligament in the notch. This is where I expect to find this tumor, this lesion. in this vicinity in the near future. So there's the anterior cruciate ligament, strong, intact. This is now the lateral compartment. There's my triangle between the lateral femoral condyle, anterior horn of lateral meniscus, lateral border of the anterior cruciate ligament, right there. And there is the opening to get into the lateral compartment. So there's the posterior horn of the lateral meniscus, intact, no tears, beautiful lateral compartment, no arthritis. So thus far, the only pathology we've really seen is the patellofemoral arthritis and the medial patelloarticular facet. In the back there, open and close, you see the popliteus tendon, this white tendon underneath right there. That white tendon is called the popliteus, going through the popliteal hiatus. And at this point, we have to find that synovial tumor. So let me have an 18-gauge spinal needle. So here we go. Going in with my needle, 11 blade. Careful, careful. Short blunt and shaver. So this is synovial tissue. I'm just going to excise this stuff. That's not the lesion that I saw in MRI. So we're going to find it. Got to get all this stuff out of my face.